So let's talk about the focus history. So common pitfalls I see: registrars not being inquisitive enough. The history is disorganized. The questions that they ask is not really selective, poor use of question. And there's a lot of question that's just going in circle, clarifying, and not really progressing. So it's not really focused, it's just very vague, and there's not really good history in that. And then there's excessive use of summary. Other things that happen is that registrars might go and do things where they're opening new windows. For example, they're asking questions about other medications that's not relevant. Then the patient bring up other things, and there's multiple problems in the consultation. So these are common pitfalls you want to avoid to take a focus history. So when you're taking a focus history, I'd like to use this analogy where, let's say you're going on a treasure hunt. It's on a vast field, and you're looking for that treasure. What are the things that you need to get to this treasure? What are the tools that you need?
A map.
Yeah, you need a map, because without a map, you're going to get lost. That's very good, Osama. Anything else?
A shovel.
You need really to be equipped. Otherwise, you're just going to waste your time and energy. So if you've got a shovel, but you haven't got a map, what you're doing, you're going to dig in the wrong place. And it's going to take you a lot of effort and time where you're not going to get the results you want. But if you've got a map, you know exactly where you need to dig, because you know where this treasure is. So that's why you need to be organized. So when you've got a map and you've got your shovel, then you can start digging where you have a higher chance of getting to the treasure. So the map is really like the structure that you've got. When you've got a structure, you know exactly at 2 minutes where you're at, 4 minutes where you're at, 6 minutes where you're at, so that you're going on track. And then the shovel is the questions that you're asking. Each time you're digging, you're asking a question to get more information, and that will lead you to the treasure. That's why it's so important to spend some time in the pre-consult. Before you even consult your patient, you need to do that prep, because if you don't do that, then you're just going blindly. So what you do, you scan the patient's record. That's really important, to look at the record to see whether there's anything relevant. You prime your case beforehand, and you anticipate the consultation. So by that, I mean that what you need to do, you play the consultation out in your mind. If you're playing it out in your mind, you're thinking about the consultation and how it's going, then you're organizing your thoughts and you're considering the potential diagnosis. And if you find that there are things that you're finding when you're doing that exercise and you think you might forget it, just jot it down. Jot down on a fresh piece of paper what you plan to cover. Because when you do that, then it's less likely that you're going to forget things. Because sometimes I see people, they forget a lot of things and they have not really planned this out in their mind. How long did you give yourself in clinical management?
So that's a tricky thing. I try to use most of the time for my clinical management, but there are cases where I would say like the big chunk I will use that for the clinical management, because mark wise it scores a lot as well. So again, it is case specific, it's hard to tell, but I would say like it's in a 12-minute consultation, I would definitely give at least 4 to 5 minutes full for my clinical management to clearly describe that.
So yeah, clinical management is more heavily weighed. That's why it's so important to give yourself enough time. Otherwise you rush it or the management plan is inadequate. So when you think about the priming phase before going in the consultation, did you also prime the clinical management?
When I'm priming the case, like when in the exam, you get the question, like there are like very minimum information for that question. So it's hard, like you really don't know much, like there will be like very few things. So in that situations, what I would say, don't think too much what it could be, because that will create like a lot of anxiety again. Just like stay calm. Okay, so there is no much information, so it could be anything, could be a simple thing, could be a For example, it could be a child protection or like safeguarding issues, basically. So those type of things I would always think about when there is a details or minimum. And in this particular exam, I've seen when having a case, like there are like multiple issues patients brought up as well, and I tried to address those issues, and I was like very concerned. Oh my god, why the patients talking about 2-3 issues at the same time? And in the management, I gave them all the management, but apparently I scored well in that as well. So don't think too much about when you're priming the case. Just like if you have any information, good. If not, just keep cool.
So it's important to expect the unexpected, because you might see a case briefing and then when the patients start talking, it's completely different as well. So you mentioned something very important, as in about the anxiety. Yeah, it can be overwhelming when you're reading it and you're thinking. So were there any things you found quite useful when you were thinking about how you manage the stress of exam?
With the stress of exam, like obviously, like I would say, like the more you practice, the more put yourself into that situation. It is really helpful. For example, like when it comes to the whole program, like when we have this the 12 cases which we do with the patients, I think like when other people are watching you, and when you're doing cases well in those situations, actually I think like I did a couple of cases when I was doing the 12 cases. Just because first case I didn't do well, but the second case I gathered the confidence as well. So I would say like you need to put yourself into the pressure of like the time pressure and practice with many different people so that you don't get comfortable with one particular person when you're doing the case. And that way you can eliminate that anxiety, gain more confidence just to handle whatever comes in your way.
If you found this video useful, then I'm sure you're going to get a lot from watching this video. Click the video to watch it. Take care, everybody. Bye-bye.